Morning News continues. Thanks for listening this morning. House call with the folks at Astria. Hey, and we have Dr. Raul Garcia in the house this morning, and he is an emergency medicine doctor in the emergency medicine physician at Astria Toppenish Hospital, graduate of New York Institute of Technology, College of Osteopathic Medicine, one of the nation's largest osteopathic medical schools. And hey, he's in the house. Good morning.
Good morning, Les. Good to be here.
Good to have you here, Doctor. Appreciate it. And knowing that you handle emergencies, I mean, this show is a heartbeat away from a medical emergency any day. Me killing Lance, Lance killing me, Jack killing us both. It's just nice to know that you're out there, sir. So
thank you.
Something had to happen. But let's talk about a medical emergency. What kind of stuff qualifies? I mean, I think we know, but you're the pro. So how would we define medical emergencies that you wind up treating at Toppenish?
Well, you know, we really treat anything that comes in the door, but what I would say to everyone listening out there, the obvious signs of chest pain, of having weakness on a limb, things that could be life-threatening of a stroke or a heart attack. But the most important message to everyone is any time that you feel vulnerable. Okay, we know how healthcare is these days, and the access to a doctor is not there every day.
Right.
So we see a lot of people in the ER that just can't get to a doctor. And they may need just their medicine so their blood pressure doesn't go up. They may need to feel good about their child acting different, right? And we want those parents and we want those patients. When you're sitting at home and you're feeling vulnerable and you don't have any answers, that's what we're here for. I mean, emergency medicine is a specialty that really helps the community every day feel safer about their health.
I think that's a great way to put it, Doctor.
I agree.
When I consider emergency, we think of, you know, pull them out of the car and drag them in, but a person could feel in an emergent type situation just because of lack of access and information. And to them, it is an emergency. And so, like you say, with that is the philosophy that you embrace all sides of emergencies, if you will. That's excellent. That's what communities are. I've had limited experience, but I've had a few procedures done down at Toppenish. And I got to tell you, I was so impressed with, first, the vibe, chill, cool, not a lot of craziness going on. Very nice people, very helpful people, more than willing to give you the extra information that you want to know as a patient. So I wanted to give a shout out to, because I've had great experience. In fact, I left my gallbladder down on top of it. If you should find it,
thank you.
You don't need to mail it back to me.
We do have wonderful surgeons down at our hospital.
I noticed you say symptoms that many people aren't sure why they should go to the emergency room. What are some of the signs that you should seek emergency care? And you say symptoms that feel life-threatening. You know, I mean, I suppose you get people that have chest pains and you tell them that's gas or something. I mean, you know, right? I mean, you could feel threatened just that way.
Sure, but don't play roulette at home. Let us decide that chest pain is not a heart attack.
Right.
You know, it could be many other things, but we have the resources to send you on to get a solution to your problem, even if it's not an emergency that day. For example, if you have really bad gastritis, you know, the inflammation of your stomach, if you have a lot of acid reflux, and that's causing chest pain, a lot of people have heart attacks that come on that way. So let us decide that it's not a heart attack, and then we will refer you to one of our GI doctors who are both Dr. Lee and Dr. Ong are fantastic, and they will examine why are you creating so much acid, why do you have that inflammation, and put you in a plan so you could not have it in the future. You don't really need to stay with this disease forever.
You know, we are heading great advice there. Get answers. Don't just treat the symptomology. We're heading into the heat season. We got the 90s, not this week, but coming up into next week. And good old Yakima sunshine. People will be out there. Next thing you know, maybe spend a little too much time in the sun early on. What's the sort of guidelines and the guidance that you provide for folks when it comes to heat stroke, we always hear kids in football, summer practice, succumbing to they don't know what's going on. All of a sudden, they're in a heat stroke situation. What's the real deal on summertime heat?
Well, it's actually a huge reality that we see in the emergency department every summer. We see a lot of people with heat exhaustion. Of course, we have a lot of farm workers that are out there hours and hours and hours in the heat. And some of them have a heat stroke, and a heat stroke is a very critical emergency. You need to come to the hospital immediately, and it could happen to anyone. I could tell you, I had a heat stroke working in the emergency department last year, July 12th, right? July 11th, I spent the whole day out as a foundation member of Central Washington University in a ceremony for 4 hours, and it was like 112 degrees.
Wow.
And we were out in the sun. And we were getting baked. And then I went to a wedding that was outside, too. And I didn't really hydrate much that day. And I felt really tired. The next day, the computer started changing numbers on me. And I said, oh, there's something wrong here. And all it was a heat stroke. But we needed hydration right away. We needed salt to come into my body to change that. And thankfully, it was nothing. But it happened to me, and I'm a physician, right?
Right.
And a lot of people say, well, physicians are the worst patients because, it can never happen.
I have heard that.
Yes. So it could happen to anybody out there that's out in the sun and not hydrating enough. Now, one of the things that I may add here is that we doctors tell our patients salt is not good for you, right? It increases your blood pressure. But when it comes to dehydration, actually salt is good for you. So the biggest chefs in New York City that work at 120 degrees in their kitchen eat salt pills every day to make sure that they stay hydrated. So a well-balanced meal with the hydration works. And if you are not having that, then you need to have a little salt to keep that hydration in your body. If you don't have air conditioning in your home, which a lot of people in our city don't, go to the mall. Spend a day at the mall.
People watching.
Go to places that have air conditioning. Make sure that you're cool, especially children and the elderly, right? And a lot of the cases that we see in the emergency department are elderly folks that are home without air conditioning, not hydrating, not eating a little salt, and I say a little salt, okay, and that's not overdo the salt. To stay hydrated, you need to be at a cool place and have that in the forefront coming into the season that is so harsh on us because it gets really hot here in Yakima.
No question. Lance, moments ago when he said the numbers on the computer started changing, I thought Jack was hacking in again. Apparently that wasn't what that is. It was more of a warning sign. So, but all of these are great tips and great ideas. We're coming into heat. It's going to be here. And if you have senior members of your family, you really want to watch out for them and the circumstances they're living in and all the advice to get out and into some place where it is cool or bring them to your home, whatever it is. But I remember as an athlete basketball player, we got salt pills, pop them at halftime if you really worked hard in the first half because you just sweated everything out of you. So staying hydrated and staying on point, watching out after the people that you love and care. And I think as Astria tells us here, to listen to your body and take heat seriously.
Yeah, and some of the signs that you will feel are nausea and muscle cramps. And that is the time to come to the hospital, okay? You're almost there at the heat stroke level. First is heat exhaustion, and then it'll be heat stroke. And you can die from heat stroke, right? And the difference is that your brain now is involved in this disease. You start with heat exhaustion of the rest of your body, and then once your brain becomes involved, then that is heat stroke. So all of you that like to hike out there, Lance and I talked a a few years ago when we walked 185 miles from Toppenish to Seattle.
Yeah, I remember that.
In the
Let's
name
clarify.
of
Lance didn't go. You did that, not Lance.
I was just going to say, you did that.
Yes, you know, in raising awareness for fentanyl in our area, right? And I could tell you, the very first day from Toppenish to Yakima, it was the worst day.
Yeah.
It was hot. It was, 125 degrees with that asphalt coming back at me. And I remember I had a KIMA interview at the Arboretum, so I had to get there.
Yeah.
And they were putting ice on me, and I was full of muscle cramps all over my body. I was heat exhausted at that moment. And a lot of my doctors feel that turned my body, that for the rest of my life now I'm susceptible to the heat. So remember that. Once you get heat exhausted, your body, it'll be easier to click into that heat exhaustion.
Interesting. It's almost like you have a limited account with your body, and you spent a lot of it the first time, right? And so you don't have that much to buffer. Well, Dr. Garcia, we're talking with Dr. Raul Garcia, emergency medicine down at Astria and Toppenish. Great information. Good to see you, sir. I guess Lance, you got any last questions, last words?
I'm good.
Got any plans to walk over to Seattle or anything?
Nope, none of those plans.
You're not going to do that? Well, last word is yours then. Doctor, give us something to chew on while you're gone.
Well, I want the community to know that Toppenish is here. We have an emergency department that I'm really proud of. All our physicians are emergency medicine board certified. They're all my friends. We really have fun working together, helping each other out, and helping the community. And everybody that works at Toppenish likes to work at Toppenish and loves the fact that we are helping a community that if we weren't there, they would have nothing. So all of you here, come on down to see us, and you'll see that we have a staff that has been there for a long time, that loves working at that little hospital and loves giving good service. So I do want you to give us a good rapport after you see us, okay? So be testing us when you come down, but we're ready to serve you.
We can get a search party for my gallbladder. Everybody come on down, and we'll do that. Anyway, Doctor, great advice. My own personal experience backs up exactly what you said. I had some gastrointestinal concerns and testing down in Toppenish, and Dr. Alvord, I think is her name. She was great. So really back up and support the things you're saying. So once again, another appreciative and great house call from our friends at Astria. Anything that the boss wants to say over my shoulder? She's smiling. I think you've done good, Doc. Thank you so much for being here.
Thank you, Dave.
Appreciate it very much.
Yes.
We'll be back. Good Morning Yakima continues. It's 8:51.